Dear friends, I am Dr. Mahajan from STEMRx Bioscience Limited and biotech company and Dr. Mahajan's hospital. Nowadays we have been hearing after a gap in India that new variant of COVID-19 has emerged. That is nothing new. We were expecting the variant will come definitely because this virus COVID-19 is known to go in mutations. But unfortunately, this mutation is a very huge mutation and not seen in earlier variants. The mutations which are seen in the cytosolic nucleus proteins are more than 50 mutations at a time, which leads to a behavioral pattern of the virus very differently. In fact, nobody knows about this variation today and how the virus is going to behave. But overall, if we see this variations which you are seeing in a mutation, which though are new, but looking at the earlier more deadly variants like Delta, Beta and other variants, this variant seems to be a little milder. In fact, milder to the extent that it may not lead to hospitalization in most of the patients, but it may spread very fast. This is the best part of it. Like, it is not as virulent, but it spreads very fast. Now, about the virulency, we just cannot comment in short span of time of last few weeks, because in November where we got first virus in South Africa. In fact, there were cases before that, but we should place South Africa for the reason they could detect this variant as one new variant and the world started looking a different way. There are challenges when we are looking at this variant, particularly therapeutic lines and second, immunization. Many feel looking at the mutations, this virus, particularly Omicron, may not be as sensitive to the vaccines as the earlier one. But my experience and my working in the field and knowledge says, as far India is concerned, we have enough of the protection, and most co-vaccine which we have used as an Indian product is a whole sequence RNA of the COVID. Thereby, the mutation should be responding to COVID co-vaccine more than other vaccines which are RNA-based or DNA-based vaccines. The second most part as far as treatment is concerned, therapy is concerned, since the symptoms are milder most of the cases, we should look at a symptomatic treatment and antiviral treatment which is standard being used as a part of it currently. But in long term, we have to see how this virus behavior is going to present to us. Till then, I don't think we can comment much about this Omicron virus. But most important, since the variant is there and the virus RNA remains the same, there is a philosophy, non-specific molecules which are biologically very active, which are derived from some kind of cell components like mesenchymal stem cells or platelets, could be more strongly effective than the drugs here. Reason being that the entire perspective of action of these biological molecules is non-specific. Whatever the variations take place, I think these molecules will take proper care. So what STEMRx has launched currently, lyophilized platelet growth factor, which is a very strong antiviral, anti-inflammatory, as well reparative, because of the cytokines and antiviral molecules in it. It should work wonderful in the milder symptoms as well as the advanced symptoms as well. I believe lyophilized platelet powder will work more componently in this condition than any other molecules. So looking at the future of perspective of this virus, it may spread out, but it may not lead to virulence that leads to ICU or deathbeds. So my friends, I don't think it's a panicky button. We should be confident. We should take proper care of basic precautions, masks, social distancing, and sanitary washes properly of the hands, taking care of this. I think this should be sufficient, along with the mutational dealing of this virus by nebulization using lyophilized platelet or thymosin will help you more better than the standard care. Any questions on this topic, if you have, you can communicate to me on email drpvmahajan@gmail.com or stemrx.in, or otherwise on my personal number 8898070904. there will be good highlight given to you on the topic, where what precautions, does vaccination works, does the therapeutic applications, and the role of lyophilized platelet powder by nebulization in these conditions will be elaborately explained to you. These things are also displayed on the video when you are hearing to communicate me. Thanks. I believe you will take care of all this virus with confidence.